Hi, I'm Sonia Meyer. I'm the National Clinical Specialist for Continence and Skincare at Hartman. Today, we're going to be talking about continence management for your patients and residents. When considering a product for your patient or resident, there's three key components. The first one is size, the second one is style, and the third one is absorbency. When you're considering the size, when a product has a waist, you must measure your resident's or patient's waist. The best place to do this is either at the tip of the hip bones or the widest part between the hip and the waist. This will give you an accurate measurement. Consider if you had a toddler and a newborn, and if you put the newborn into a toddler's nappy, it would be too big and you would get leakage at the leg line. This is no different than we're talking about adult people and their continence needs. Hartman will provide you with your tape measures. Please ask your territory business manager for some if you don't have them. When we're considering the style of a product, we need to consider several things. First of all, is the patient mobile? What are their behaviours like? The last, of course, is absorbency. Now, your continence management plan will help you identify this, as well as a 3-day pad weight check. To do this check, you need to measure a dry pad before you put it onto your resident, record what time and the weight, and then when you change the resident, weigh that pad again. By doing this over 48 hours at a minimum, you will be able to ascertain when your resident is voiding and how much they're voiding. From there, you match up the absorbency that you require for that person. Now, to understand how a pad works, I want to show you the superabsorbent polymer. Now, superabsorbent polymer is what traps the urine inside of the pad, so that when your resident voids, the urine goes down into our 3-layer absorbent core and traps the moisture inside of the pad. So even with pressure, when the resident is sitting on the pad, that urine will not come to the surface of the pad again. Now, this is superabsorbent polymer. This is what's inside your pads, and it's like fine grains of sand. Now, when I add my urine or water to it, this is what's going to happen. The superabsorbent polymers will hold up to 100 times its weight in fluid. And I don't know if you can actually just see that now. You'll see that it's actually absorbing all of the fluid. So it's not the thickness or the pulp that's inside of the pad that traps the urine. It's actually these little superabsorbent polymers that takes the urine up inside and traps it. And what you can see now is that this is now turned to crystals, or if you like, a jelly substance. So remembering, the thickness of the pad does not tell you how much a pad's going to hold. If we want to look at what a pad's hold, the best way of doing that is the drop system. So this particular pad, as you can see, has 8 drops. This pad has only got 7, so therefore this pad is less absorbent than the one I've just shown you. And this is a 9-drop. So once again, 9-drop is more absorbent. And the Molicare premium elastic pads go up to a 10-drop pad. The other thing that I want to talk to you about is something that we call curly fibre. So within the Molicare range, we have a fibre that sits on the top of our pad, which has been treated, if you like, with a citric acid type treatment. Now, what that means is the pH at the surface of our pad changes to the same as skin as soon as urine hits that pad, which means you are less likely to get skin irritation. Now, the pH of our skin is actually acidic, and it sits around the 5.5. What you see here is a pH indicator guide. So our skin sits around the 5.5 mark on average, and urine sits around 7. What I have got in this glass is an indicator fluid. Please be aware that what you're about to see does not happen with urine. This is a testing indicator kit, but I want to show you what actually happens when a patient voids into the Hartmann continence range. You can see that I have my urine, if you like, my pH at a more alkaline 7.5, and when I void into the pad, what you see is that the pad changes immediately to a pH of 5.5, the same as skin. Now, there was a study done by a lady called Professor Donna Bliss, and what she actually found in her research is that the pH not only of the pad will change to 5.5, but also the skin surface, which means that it's more friendly for your resident's or patient's skin. On saying that, that doesn't take the place of cleaning. So whenever your residents have been incontinent and you're changing your pad, you must clean their skin. People who are incontinent, their skin is what we class as at risk. So consider what you're using to clean your residents with, and preferably use a product that has got a pH of 5.5, like the Molicare Skin range. You also need to protect your skin. So if you're using a substance which has a zinc or a petroleum base, we often put it on far too thickly because we want to protect our residents' skin. The problem with that is that petroleum or zinc-based cream, if put on too thickly, will rub off onto our pad. And if it's on our skin to protect our skin from urine, it's now on our pad. It's going to slow, if not halt, the absorbency of the urine into the pad. Therefore, it's sitting next to the skin for longer. The Molicare range of our Protect cream and our Protect foam does not block the surfaces of the pad. When you're using it, you only need to use a small amount. That is enough for the whole perianal area of someone who is incontinent. And we actually suggest that you pat this onto the skin rather than rub. And what you should be left with is no indication that the cream is. You can sort of see that I've put a little bit much on because I'm just using such a small area, but it should be to the stage where you don't see anything left on the skin. But don't worry if there's a little bit there, it's not going to block your continence aids. Now I want to talk to you about the wetness indicator. So when you look at the back of the pad, you'll see this centered line, these little squares, if you like. This is your wetness indicator. You need to trust the wetness indicator to tell you when it's time to change the pad. So when the wetness indicator is 3/4 of the way completely smudged out, that's when you need to change it. Now I've got one here that I prepared for you earlier, and what you can see is my wetness indicator is completely smudged out in 3/4 of the length. That's the time to change the pad. The other thing that I wanted to discuss with you is the nighttime pad. Now the nighttime pad should not be put on before 8 o'clock at night. The reason for this is that if you put it on any earlier, you will need to disrupt the resident's or patient's sleep patterns to potentially change 2 or more times during the night. This creates an issue with falls risk because people are tired the following day. So if you put your nighttime pad on at 8 p.m, you may still need to change once in the night, but that's all. So in summary, the 3 most important things for you to consider for good continence management is size, style, and absorbency. Remember, the form pad needs to be used with a fixation pad or firm underwear. The Molicare Mobile is more suited for somebody who is ambulant. And the Molicare Premium Elastic style is more for a bed-bound patient. Remember, Continence aids do not take the place of scheduled or prompted toileting. This is something that is a fundamental right for anybody to be able to go to the bathroom. Don't put your nighttime pad on before 8 p.m. and remember, trust the technology. The wetness indicator is there for a reason.